In this video, I want to talk about the vertebral column and the bones that make up the vertebral column. The vertebral column is actually divided into different regions. We have a cervical region made up of 7 bones. We have a thoracic region made up of 12 bones. We have a lumbar region made of 5 bones. Then we have what is called the sacrum, which is actually 1 bone, but it was 5 bones that fused. And then we have a coccyx, which is 4 bones that have fused into 1 bone. So the different regions of the vertebral column: cervical, thoracic, lumbar, then sacral, and coccygeal. Now from an anterior view, I want to describe just a few features of this vertebral column. Almost all vertebrae, but not all, have what is called a body. So we can see the bodies of the various vertebrae in this anterior view. And then laterally we see projections on either side known as transverse processes. We will talk about transverse processes individually in just a moment. We can also see that between the adjacent vertebra we have a fibrocartilaginous disc known as an intervertebral disc. Intervertebral disc between all vertebrae except, of course, the fused sacrum and coccyx. Although there were intervertebral discs there originally, but when the fusion occurred we ossified those as well. Now if I turn and look at a lateral view of this vertebral column, now we can see the bodies. The transverse processes are for the most part sticking out toward us, and we can see spinous processes projecting out the back of these individual vertebrae. Now because I'm using a vertebral column with the pelvis in the way, we cannot see a real good view of the curvature of the sacrum. The sacrum is curved in such a way to help form the back of the pelvis, and the sacrum, the curvature of the sacrum and coccyx together is known as a primary curvature. That is a curvature that is there at birth. Then we have the lumbar curvature curving the opposite direction. That will be a secondary curvature. Then we have the thoracic curvature forward again. That is a primary curvature. And then the cervical curvature back the other way. So the different curvatures of the vertebral column: cervical, thoracic, lumbar, sacral. Notice they alternate in their direction of curve. Primary curvatures were the sacral curvature and the thoracic curvature. Secondary curvatures are the lumbar and the cervical. One other thing I want to point out on this vertebral column before we look at the individual bones is best seen here in the thorax and lumbar region, although it is also in the cervical region, between each adjacent vertebra. Because of the notch on the inferior surface of one vertebra and a notch on the superior surface of the other vertebra, we are left with a foramen. This foramen between every set of adjacent vertebra is known as an intervertebral foramen. The intervertebral foramen is for the passage of the spinal nerve from the spinal column out to the rest of the body.